few things to talk about in terms of COVID headlines. Let's start with this new variant that has been announced, B1525, I think is its very catchy title. What can you tell us about it? How concerned should we be?
Yeah, hi, morning everyone. Yeah, this new variant has been identified by the University of Edinburgh. They're calling it the B1525 variant, and they're keeping a very close eye on it. So far in the UK, 33 cases have been identified, and it does share that worrying mutation with the South African variant, the E484K mutation. There's a lot of these numbers around, but that mutation means that the spike protein, that all-important spike protein on the edge of the virus, which helps it get into human cells, can be mutated to a degree where it can escape some of your immune cells, so some of your attacking cells that destroy the virus. They're keeping an eye on it. They don't know how infectious it is, so it may not be a problem in terms of spreading, but they're going to do door-to-door tests in areas where it has been identified so it can be contained. But it's too early to decide whether it'll be a big problem for us. So far, the focus really is on the UK variant and the original variants.
What is a big problem for a huge number of people is this new group of people are now being advised to shield. So it seems to me like they've collected together a number of factors that put people at risk and then decided that if you have enough of those factors, you need to start shielding. And it looks like the factors are ethnicity, weight, and where you live. Now, is the where you live bit to do with the fact you're in an area of high numbers of cases, or is it to do with the conditions you live in and the environment you live in? It seems to be a little bit confusing.
Yeah, the where you live bit is more about social deprivation. So we know that people who are from socially deprived backgrounds are at higher risk of dying with coronavirus for a number of other social reasons: crowded houses, jobs they may work in, underlying health conditions. But this whole new system has been brought about by Oxford University. It's a more sophisticated tool to identify people who need to be shielding, and it's identified 1.7 million more people on top of the 2.2 million people who were already shielding, and they'll be receiving a letter to ask them to shield until the 31st of March. Like you say, it takes into account ethnicity, weight, and social deprivation. That's the area where you
social deprivation, specifically, because I don't understand why, if you're at risk because of social deprivation, as you say, because of social factors, you're likely to perhaps be on a contract, which means that you don't get covered if you have to take sick leave, you have to then feel forced to go out and work. There's a whole situation. Why is that helped by shielding? Why does that make the causes of your problems, the social deprivation, any better? It seems to me it could potentially make it worse.
Yeah, that is true. So people who are asked to shield are asked to stay at home. Now, they'll get the support needed that shielding people will get that they won't get otherwise. So they may get financial support, delivery support for food, all of that kind of stuff that if they weren't asked to shield, they wouldn't get.
That makes sense. That makes a lot of sense.
But equally, 1.7 million people is a huge number. I think 820,000 have been rushed up the list of vulnerable people to get their jab way sooner than they would have thought. I mean, I wonder if suddenly you get a letter telling you that you're one of these 1.7 million people and you need to rush, how worried you would be the fact that it's got to nearly a year into this whole pandemic and only now the government are turning around and saying, actually, we realise you've been at a much greater risk than we thought.
Because I think the report was published last October, wasn't it?
Yeah.
So why now?
Yeah, no, you're absolutely right. So Oxford University have been looking at the data that's been coming out of hospitals, people who have been dying from coronavirus. We still know that age is the biggest risk factor, but they've looked at all of those things. But people will be worried. There'll be people who welcome the news, thinking, OK, now I can shield, that will protect me. But there'll be people worried about their livelihood, what it means for other household members. And it's really important that the government get this right, that they get the information, that they get all the support that shielding people get. And like you say, they will be prioritised for the vaccine, and that might be welcome news for some of them too. But it will be worrying. There's no way around that. It will be worrying for some people.
We know that COVID has had a huge impact on people who aren't suffering from COVID, who are trying to get treatment for other very serious illnesses. The waiting lists have gone up. It looks like it might be about 10 million people by April that are in that position of not being able to get treatment. It's a huge number of people, isn't it, that could potentially be left without treatment they need to save their lives and certainly make their lives better by April.
Yeah, there's no doubt that COVID has impacted other NHS services, and we're seeing that. And I'm talking to patients, who are waiting for operations, who might be in pain or waiting for treatment, and who are getting sicker as well. And that is really, really hard. It's going to be hard coming out of this pandemic, getting the NHS back up to track, getting those waiting times down, because not only are the patients suffering, but the NHS staff are also exhausted, tired, and there's got to be a realistic expectation on them. It's going to take time to get that down. It's going to take additional resources. The NHS is going to need additional support from the government. We've got to be realistic about it from both sides, the patient side and the staff side.
Can we talk a little bit about vaccines as well? Lots of people talking about the side effects of vaccines. My parents have both had their first jab, and my dad had no side effects whatsoever. My mum, however, had a very aching arm. She had headache. It took her a couple of days to get over it. She was advised that that meant that the vaccine was working. It was working really hard within her body. My dad then started panicking that his hadn't worked because he didn't get any of these side effects. Can you just clear up some of the concerns over side effects, Amir, for everybody?
I can, certainly. Side effects are really common after any vaccine, including the COVID vaccine. It's impossible to judge by the side effects you have about how well your immune system is working. So whether you have lots of side effects or no side effects at all, it won't tell us how well your immune system is working. So don't focus too much on that. But they are common, and they are mild, and they are short-lived. And the reason behind them really is when you get injected with that bit of material that your body recognizes as foreign, it starts off an immune response, and you get chemicals called cytokines which trigger off your immune response. And these cytokines also cause a bit of inflammation in your blood vessels and your tissues, and that can give you that temperature, aches, chills, fevers, that kind of thing. But it's not a bad thing. It's a sign that your immune system is being triggered off. But it varies from person to person. So some people will, some people won't have side effects. Most of them last a day or two, maximum a week, and can be settled down with just some paracetamol.
Also, along those lines, interestingly, France has become the first health authority to recommend that anybody that has been previously affected with COVID-19 only needs to receive one jab instead of the normal 2 doses. They've basically said they've had 4 studies. The single dose for someone who's recovered from coronavirus within 3 to 6 months produces a sufficient, immune response to protect against further infection. Could you see that happening over here, Amir?
I can't see it happening over here yet. All the trials done on the vaccines were based around 2 doses, several weeks apart, and I think we're going to stick to that. And there is a plan actually to get most people to have their second doses by the autumn time. So I think that's the plan here. Theoretically, the French studies do make sense. If you get the coronavirus, your immune system is primed, so that first dose can act like a booster. But I don't think we'll see that over here. But I think countries who are struggling with numbers of vaccines and getting it rolled out, may find that information helpful. We're not in that position.
Right.
Somebody who's flagged up what feels like an unfair anomaly in the system we have for vaccine distribution at the moment is Jo Wiley. She's been talking about her sister. She's 55, Jo. Her sister's 2 years younger. Jo was offered the vaccine because of her age. Her sister, who has learning difficulties and is being cared for,
She's got
separated.
diabetes as well, hasn't she?
She's got diabetes. So 2 things that make her vulnerable statistically to having a very serious effect of COVID. She wasn't offered it. She's now got it. And, of course, it's causing a huge distress because they can't get to be with her. It is strange, isn't it, that you'd think those 2 factors would make her vulnerable and higher up than someone like Jo, who is fit as a fiddle and was said she'd have happily given up her vaccine allocation.
I think as well the statistics, Amir, adults with learning difficulties are 6 times more likely to die from COVID-19 as well. I mean, that's a stark statistic, isn't it?
It's really stark. And actually, younger adults with learning disabilities, 18 to 34, are up to 30 times more likely to die. I'm really glad that Jo Wiley has highlighted this problem. People with learning disabilities have faced health inequalities, access to health issues for a long, long time before COVID. A lot of that comes down to healthcare professionals not making reasonable adjustments to their learning disabilities, them finding it difficult to access healthcare because of their learning disabilities, fragmented healthcare across the board as well, and underlying health conditions may go undiagnosed as a result. All of this puts them at risk of getting complications from the coronavirus. And I know MenCap, the charity that represents a lot of these people, have been working really hard to try and prioritise people with learning disabilities at the moment.
Why wouldn't she have been higher up the list than Jo then? Because all those points, make you think she would be.
You would. So at the moment, only people with severe learning disabilities are prioritised. People with mild to moderate are not. But the problem with that is it's really hard to decipher between the three categories of learning disabilities. The set criteria makes it difficult. It may not be coded properly in patients' records. And what MenCap want, and I support this fully really, is for all people with learning disabilities to be prioritised, because they are at such high risk of getting and dying from coronavirus. And it's so important that they do that.